Ukraine is in the second place in Europe in terms of spread of cancer. Each year, cancer kills about 80 million people. 35% of them are of working age. Every day in Ukraine, 250 people develop cancer, 250 of who die. World Statistics provides information of cancer mortality rates. Near 6 million people in 2016, meaning every 8th person dies from cancer. Ukrainian scientists have identified the unique vaccines. The goals of cancer vaccination are to activate the expand tumor-specific T cells as the effective means of augmenting immunity.
The number of cancer patients in Ukraine exceeds 1 million people, and 70 to 80% of them needs to undergo radiotherapy. Every fourth male and every fifth female in Ukraine face increased cancer risks. This is a very large share of patients.
Doctors diagnosed Nicholas OVERCHUK lung cancer a month ago. He was brought from the Dnipropetrovsk region to the KIEV Oncology Center. Revived tumor in the lungs, but now treatment is assigned. I think I get well. The doctor-oncologist Olga PONOMAREVA said the result of clinical trials of cancer vaccines provide effective in the treatment of breast cancer. However, she recognized the last stages doctors resort to chemotherapeutic. Chemotherapeutic is more extensive spectrum and it's used in the most of malignant tumors. Chemotherapy toxicity cures, people are aware of it. 65-year-old Larisa Koshechkina says after they are diagnosed with the breast cancer, she underwent a course of chemotherapy after doctors removed a malignant tumor. After the operation, the woman agreed cancer vaccine clinical trials. After removal of the breast, I came here and started taking auto vaccine. Now I feel well. I consider myself totally healthy. An adjuvant is an ingredient of a vaccine that helps create a strong immune response in the patient's body. This unique cancer vaccine, invented in this biotech center, its two-component composition, tumor patient's own cells and product of microbial synthesis, called enhanced defenses. For example, the cost of 6 months course of treatment similar to Cuban vaccine over 10,000 euro, Ukrainian counterpart 8,000 hryvnia. One of the inventors, Professor Grigory Potebnya, said vaccine is prepared individually for each patient. With the help of our auto vaccine, more than 5,000 patients are treated. If it's stomach cancer, use of auto vaccine improves 5-year survival rate of 30% of patients with breast cancer, by 17% of patients with lung cancer, by 37%. Vaccinotherapy has no side effects and it's not toxic, academician Vasily Chehun says. However, there were not auto-vaccine standardization procedures at the Ministry of Health.
The development of strategy of combination immunotherapy with cytotoxic and molecular targets against for future multimodal cancer therapy will eventually great progress and ultimately lead in important outcomes for patients received cancer immunotherapy.
Chief oncologist of the Health Ministry Valery CHESHUK said that the scientist must submit all necessary documents to standardized vaccine in State Expert Center. This may take several years in the Ministry of Health. Working group should consider this question. The vaccine is registered in some localities and all these materials go to the State Expert Center. It can take in average 3 years. The mechanism of therapeutic action of this vaccine is following: stimulation the activity of mechanism of anti-tumor immunity. It increases the activation of natural killer cell-specific T lymphocytes. The use of this vaccine is a post-operative period reduces the availability of the remaining tumor cells, thereby prevents the development of metastasis and recurrence.